Thank you very much for the introduction, and I hope that things will be. This is. Oh yes, this is my slide. Okay. Anyhow, it's a nightmare actually doing CERAP for a recurrent aortoiliac lesion. The patient is diabetic, 52, hypertensive, had history of iliac stents a few months back, but the same complaints again, and CT angio showed occluded kissing stents. These are the angio occluded stent, as you see, and this is the occluded stent, but when we had a closer look, we found that there is something in between the stents which we didn't know what was this, but looks like crushed stent. So we guessed that the previous operation was having a stent. He was not happy about it, so he crushed or something like that and put another stent. And it's not working. Slides are not moving. Yes. Okay, so we did an angio from the right side, and you can see that the contrast stopped at the stent again, and from the left side again the contrast did not but stopped at the stent. So we were hoping that we can pass the two stents and put an aortic stent and then another two iliac stents, and that's it. Yes, this is, we crossed the right iliac stent easily, and we were in the aorta and we did the angio like that. And then we also crossed from the left iliac, but the strange thing that we found ourselves in the subintimal space. And you can see even that the right renal is supplied from the subintimal space, and we were a little bit confused. Did we make this section, or it was done before? We went back, and you can see even contrast from the stent showed this subintimal space, and we discovered that this stent was completely in the subintimal space. So we after some manipulations, we could reach the true lumen from the false lumen, but it was high in the aorta, above the renals. So we decided to do septotomy and have the false and true lumen as one lumen, so we can put the aortic stent. And this is the wire coming from the left side and the snare from the right side, and we snared the wire, and we went back nearly to the bifurcation, and we thought that the situation ends, and now we injected from the left side. We could reach the aorta, so we had the courage to put the aortic stent, and you can see now this is from the left side, so we were happy, and we put the aortic stent, and it was funneled as usual, as you see, but now when we wanted to, sorry, I'll go back. No, sorry. Okay, this was the aortic stent, and then we retrieved the wire from the left side because it was behind the stent, and trying to cannulate again the aortic stent, it was very, very difficult. We tried many times from below, we could not. We tried even from above by brachial axis. Again, the wire was always going to the right side. We put a balloon to block the right side, trying to go to the left, but again, it was not possible. We went with two balloons technique, one from the true lumen and the false lumen, just trying to crush the membrane in between, but again, it did not work. Finally, we found that during manipulation, the wire from the left side went to the right side, so we wanted to make use of this accidental passage. We got the wire from the right side, so at least to have some body floss, we can do something about this. And we put a balloon from the left side to the right side, trying to break this tissue. Again, all this did not work. The only thing left for us was this out back, to have one balloon from the right side, this big balloon, into the aortic stent, and then we puncture the balloon by this out back catheter, and this was the only thing that we could cross from the left iliac stent to the aortic stent. And this is after inflation of the stents, and this is the final result, and this is the this. Thank you very much.
Any question? II Aortic?
Nice case, sir. What you discovered in doing the angiography was not discovered by doing a CT angio before the operation to find this crushed stent, or it was accidentally discovered on the angiogram?
Well, we realized by the CT that there is some shadow between the two stents, which we didn't know what was that. But and we don't have any history, any report about what was done before. But we guessed it is a crushed stent. So we know before that we have something in between, but we thought that it is a problem solved. خلاص, it's crushed, and we have two iliac stents. We'll just cross the two iliac stents and put aortic stent and come back. But it was a little bit difficult.
The next question, didn't you think at any time that you want to do an surgical aortic bifemoral or something like this? I think you were exhausted by doing all this procedures.
Yes, yes. Well, I actually, if I didn't succeed by the last maneuver, I would have nothing to do but aortobifemoral, yeah.
Any other question? Thank you, Professor Mahmoud Salah.
Thank you very much.